But to continue our introduction of partners, today's discussion is being facilitated by a longtime partner of the Healthcare Association, Nancy Babbitt. She's a longtime friend of the Forsyth Chamber. She served as the administrator of Roswell Pediatric Center for over 20 years. She is a practice transformationalist with expertise in medical practice operations, governance, and technology, and she is passionate about helping practices of all sizes, which is why she is here working with us today and working with us on what I know is such an impactful and timely topic. So please join me in welcoming Nancy to our meeting today.
Can everybody hear me okay? All right, good morning, everyone. Nice to see you. Good morning to all of our virtual attendees back at your practice. First of all, I just want to say thank you. Thank you for taking the time this morning. We're going to have some fun. And as Laura said, I've done what you guys do. I know how hard it is to show up every day and put that smile on your face and be the leader in the practice and bring the hope, especially what we've gone through with the last 2 or 3 years. So I admire you for taking time out of your day, because I always know I had a list, right? When I'm in the morning, like, I'm going to get this done today. And then the real world happens. Like I saw Kathy over here on her phone this morning, already put down a few fires and dealing with things. So what we're going to talk about today is so important, because we all have been dealing with critical staffing shortages in the last few years. So it's an honor to be here today, and I'm looking forward to talking with y'all. And as she said, I am the facilitator. So I have bribes for you, scratch off tickets. So anybody that's going to help me and give us some good ideas, we want to hear just as much from you today as me standing up here talking. So the agenda real quick, what we're going to cover today in about 45 minutes are the state of the industry. So I've done some research for you. Y'all know I'm past board chair of Medical Group Management Association way back in 2012, but still pretty active with them. And I've got some statistics just to kind of verify that, you know, what I'm seeing out there in practices are probably what y'all are seeing too. Our added benefits is a solution. We're going to talk about that. Some shifting strategies, as I like to say, for success. And then what can we do as the leaders of our practice? Because we all know culture and employee engagement is what keeps a lot of employees. It's pay, that's important too, but we can have effects and some things that can make a difference too. And then we're going to leave on a high note. I'm going to give you some fun ideas to take back to your practice that you can implement and make the day fun for some people. I'm going to wake you up here, so it's early in the morning, but we're going to look at some statistics. So MGMA does data dive surveys every year. This one shows support staff per FT physician trending from 2019 to 2021. So we start with primary care, non-surgical, and surgical, and we have physician-owned and hospital-owned. So we can see the physician-owned from 2019 to 2021, we went down almost 1 FTE. Not a big surprise, right, for anybody in the room that's been hiring and trying to staff. Hospital owned went down about half FTE, non-surgical went up about 0.28, so we're seeing a little trending going the right way here, 0.25 for hospital owned, and then surgical went down, but not significantly. So I think we're seeing that trend. Are you guys seeing that? Do you think in 2023 it's easing up just a little bit in staff retention, recruiting? No, I'm seeing a lot of no's. From a hospital, maybe a little bit. Practices though, you guys are still struggling. So in between our yearly surveys at MGMA, we do what we call MGMA stat polls, and this one's more relevant. It's a quick snapshot of data. So this was July 2023. How has your ratio of support staff to FT physicians changed in 2023? So we're seeing a little bit of trending going up. 30% said they've increased. So the ratio of support staff to full-time physicians gone up. 30% said that. 40% said they stayed the same. 30% said they decreased. So we are seeing that trending go just a little bit in the right direction. Let's talk about nurses, right? How hard is it to find a good nurse, right? So how have your recruiting and hiring efforts for nurse roles changed in the past year? 46% said they worsened. 17% improved, and 37% stayed the same. It's a little funny after all that depressing news. I don't know if it's burnout, but I set off the smoke alarm 6 times today. Everybody feel like that? All right, medical assistants. Medical assistants, I think humbly, are the hardest position to find the most practices I deal with. We go back to April of 2022, what's the most difficult role to recruit right now? 44% medical assistant, 27% nurse, 11% other clinical staff, and 18% administrative or billing. Sound about right? I'm seeing a lot of heads shaking for your virtual audience. I'm thinking you're thinking the same thing. Now we fast forward from April 2022 to June of 2023. Have you updated recruiting and/or retention strategies for MAs in the past year? 67% have had to rearrange and do some different things different. So let's take a minute here and just think about us and what our role is every day. I know we have private practices in the room. I know we have hospital-owned practices in the room. Whether you're a private practice or a hospital-owned practice, we don't own it. We don't always set the budget. We don't always have the power to go in and say, oh, I'm going to give everybody a 4% raise this year, or whatever. We don't control those things, right? So a lot of what I'm going to talk about today are things that, yeah, if we had control of that, we could do, but I want to talk a lot about today of what we can do, because we may not be able to give the raise that we want to give, or we may not be able to give those extra benefits. We're going to go through those and we're going to talk about them, because I want to make sure that you guys know what is going on out there, but I don't want you to feel bad and leave here like, oh, I can't do that. Nancy just told me stuff that I don't have control over. So we're going to go through some of that, but I'm going to count on you guys too. I want your input. So if there's things that you've done that have helped you retain staff or recruit a good member, please speak up and help us. Let's learn from each other. So one thing I saw trending into 2023 after the last 2 years was, are adding benefits the solution in 2023? That's what we've been doing for the last 2 years, right? We've all been scrambling. We've been taking every penny out of every bit of our budget that we could to go to staff recruiting and staff retention. But not this year. Now we're saying 65% of practices are saying no. No, only 35% are looking at it. Why? Well, like I just said, most of us done it. Most of us tried everything we can coming out of that pandemic to get people to come back into the office, to get them to work, to get them to stay more than 3 months or 6 months or 2 days and then leave for lunch and not come back, right? We've all had that happen. So greatly expanding those benefits, we've been doing that, and just, frankly, we're in a financial situation, and sometimes you get in that bad circle. We all know what this has caused for our practices: shorting staffages, overtime, loss of productivity, people getting burnt out. Welcome, good morning, come in. People getting burnt out, quitting, right? Especially physicians. Ugh, I hate physician burnout that we're seeing. So we just know that financially that's not sustainable, so we've got to come up with other ways. All right, so some expanded benefit possibilities that I've seen a lot of practices look at. Some over the last 2 years, some are going to look at them this year. But what can we do about retirement? There's so many things that people, we want to get them to stay. We were just having a conversation, someone's going to be planning to stay at their practice the next 10 years. They're looking for someone that can come in and work with them over these 10 years and be that legacy and take over for them. How do we get that? Well, retirement is something really important to think about. You already have one at 401k. Can you maybe find a little bit of money to go up on that match? We all have paid PTO, wellness, sick days, but what about a mental health day every now and then? Do anybody do that? Get creative with your time off? Employee assistance programs, do you guys have those? I know the hospital practices probably do, but a lot of private practices don't, and they're really not that expensive. It's a per month, per employee fee, and it's basically the 800 number that they can call and get counseling and support services, or somebody has trouble in their family, they can get counseling, things like that. I think most of us probably do the next one, the tenured-based bands or tiers, so the longer you work, the more time you get paid for any time off. So everybody's doing that. So what are you guys doing when you bring in a new employee? Do they get paid time off right away, or do they have to work a little while?
Work.
90 days.
90 days, and then they start getting time off?
Good time.
They approve that then.
So hang on, just let me get, what did we do at that point? Oh, I know what we, yeah, you can go, Mike. All right. Let's see. Just doing it?
Testing, all right. So would you just say that on your side, would you share that?
They start accruing from day one, but can't use it until then.
They accrue from day one, but they can't use it till day 60. Okay, cool.
Yeah, and it's not like corporate road where you're trying to like 15 minutes of
Accrual from day one.
like from a hospital standpoint, like employment,
We want to make sure that people virtually can hear you. We can hear you, but they can't.
yes, like for the corporate procurement. Well, like 3 weeks, or 4 weeks, 5 weeks from day one you were granted it, you start using it any time. From a hospital base, you do get to start accruing, you can't use it until your first 60 days, after 60 days, but it's an accrual, so basically you're starting from zero after our governance.
Right. Is that pretty typical of everybody else?
If there's a major holiday, they'll get paid for that, but they can pull from their PTO ahead of time, and then
Okay, so if there's a holiday, they get paid for that.
they will get paid.
Okay. All right, so good things. Health savings account, is anybody doing that?
Yeah. How about private practices? How many people in here for private practice? Do you guys have health savings accounts? Yeah. Have you ever looked into it? Is there a reason you could share why you didn't do it? Just cost or?
You're referring to health savings accounts based on like a high deductible.
Wait, let me get back to the
Health savings account based on like a high deductible insurance that we're offering. So we actually do have that for the high
option?
deductible. Yeah, we do have that for the.
Okay.
One thing we don't do, we need to do, I think, is look into accruing PTO immediately.
Yeah.
Versus, waiting the
90 days.
and then starting fresh from there.
Yeah, I think that's a good point. I think it make you more competitive, right? If you started that right away, they can't take it right away, but I like that, what Kathy and, I'm sorry, I didn't her name up here, with the hospital, I think it's a great idea to start the accrual from day one, but then, you can't take it for 60 or 90 days. So anybody doing long-term disability, short-term disability?
Part of our benefits.
Part of your benefits. So in private practice, if you haven't looked into that, the cost for long-term disability is really pretty reasonable. It's not a huge expense. It's something you might want to look into. It's a great benefit for employees. Horsepower. I'm just gonna step over here for a minute, Lauren. Good thing I said that, I don't know what's wrong with the. Sorry, you're frozen. Sorry. Well, that's why I bring paper. Go back to the old fashioned way. While she gets that hooked up for us. So the next slide will be up in just a minute, but some of the ideas that people had said to me on this were professional development. So can you send people out or bring people into your practice to give them certifications? Maybe you hire a medical assistant that's not certified, but they want to get certified. Maybe you do some in-house training. Tuition reimbursement, is anybody doing tuition reimbursement? Yeah, you guys are, hospitals are, private practices, I don't think usually.
We've done some in our billing department.
Really? What'd she say?
That was a good one, your billing department? So tell us a little bit more about that for certifications for billers.
Yeah, we have paid for, supported some additional training and certification for coders, that kind of thing in our billing department. There's been just more of a need we've seen in our billing department with our clinical staff, but we've certainly done.
What type practice are you? Family medicine? Right, wow, I love that. Any other ideas from people or certifications that staff might want that you've been able to help?
Kathy, hang on, I'm kind of.
I know.
No, I love it. It keeps me up and going. I mean, it's 8:30 in the morning, we gotta get going.
So, of course, being in the medical world, we all have to have that basic life savings, and it can be a cost either to the practice or to the individual in your practice. We do have a training center just on exit 13, and because you guys are in healthcare, whether you're employed or not, you can get that for free through Northside. You just have to come to us on exit 13, and I'm happy to send a little email out, but at least that helps a little bit.
Oh, what a great resource, thank you.
Work at the diagnostic clinic. Our certified medical So recently they started giving them 90 days to get certified. So I'm hired them. When they get 90 days to get certified. And then the BLS, Lee comes to the diagnostic clinic every 3 months to do our BLS.
That's special, so I was like, I wasn't gonna publish that. Because other practices want us to come to you and with just how huge,
Yeah.
how many practices are in the area. We did it a long time ago, but it just became too much. So now we just ask people just to come to our center, but there are several options to choose from all the time. But yes, so.
So can you get to Laura, and Laura can send it out to everybody and make sure that you guys get that schedules and the location on exit 14, sounds convenient. And sometimes staff likes getting out of the office and going and doing something else, so that would get kind of fun. So this next one's a little bit out there, thank you. Our star, can you give Laura a round of applause? I need all, I need.
we get all the way through
Well, okay. Hey, I need all the AV help I can get, trust me. So the next one's kind of bizarre, but a friend of mine did this in her practice, pet insurance. She went out there and negotiated pet insurance, and I have a fur baby, it's like my little baby right now, so just something to think about. It's not that expensive, it's not something everybody has to opt into, but you out there, if you have 10, 20 employees, it's something you might be able to negotiate a little bit of a discount for people on. And then legal aid, has anybody done that? I've seen that in some practices, same thing, these organizations of online lawyers or whatever, you can get a little bit of a discount if you do a group. So talking about salaries, we live on benchmarks in healthcare, don't we? So can we just, raise my salary so you guys can get a good benchmark. All right, so let's talk a little bit about those shifting strategies. This slide is based on a friend of mine about a year ago and just decided, she went to her physician, she said, we've got to do something. I can't recruit people, I'm not keeping people. What can we do to change our image and change what we're doing in this market? So this was her plan. The first thing, of course, was to do a market analysis for pay scale, for being competitive pay. We want to know someone down the hall, someone 5 miles away, are they paying 25 cents more an hour than we are, 50 cents less an hour, $1 more? So we kind of need to know where we are in the market to start with. She created a robust referral program. So she sat down and looked at her budget and looked at how much she was paying the placement agencies. So she's had, she's paying all these outside firms to go and recruit people, do the background, do all this stuff. And they said, what if we just took about half of that and created a referral program? So not only existing employees, but going to churches and organizations and nonprofits and charities that people work with within their practice, they started posting their job openings at these kind of organizations, not just your traditional go through the online services or use a placement agency. And the robust amount for her happened to be $500. So they offered $500 for referrals, someone that they did actually end up hiring. And then they paid it out, half of it at 6 months, if that employee stayed 6 months, and then the second half after a year, if the employee stayed a whole year. And I'm telling you, they have saved money because the people that brought in, not all of them, but the majority of them compared to where they were getting from other sources, they feel were a little bit better quality. They were people that, really cared about the practice, and they really wanted to find people that cared about the patient care the same way they did. And so by going to those like organizations and those kind of things, they were able to find them. Proactive management. So she really took a look at herself, and she worked a lot on training with herself and her leaders and getting up to speed on how can I be a better communicator? How can I give that proactive feedback immediately, which is tough. Like I said, we're all so busy doing what we need to do. It's hard to take time and realize our employees, all human beings need 2 basic things, right? We all want security, and we all want to be significant. We all want to be appreciated. So to take time and realize that about people and give them that feedback, even sometimes it's constructive criticism, right? And so learning how to do that and to communicate with people will have a huge influence on whether or not they're going to stay with you. So if they know you care, they're going to stay. They're not going to leave you for 50 cents an hour. So she's worked really hard on that with herself and her managers. basic thing, but take time to do that 90-day review. You hire somebody, you say, oh, we're gonna do a 90-day review after your orientation, blah, blah, blah. Do it. So many times we get busy and we forget. But again, they need that feedback. They deserve that feedback, right? 10 or 15 minutes, sit down with them, say, hey, your first 90 days, you've done this, this, and this, great, you learned these. You need to see a little improvement here that we know over the next 3 months as you get more training and you get to learn more about the practice or the specialty, you'll get up to speed on those. But it's just a simple conversation that's so important to take time with people and give them that feedback. And it starts to develop that communication rapport between you and that employee. And again, they're gonna wanna stay because you cared enough to sit down and tell them how good they're doing and maybe a few things they need to improve upon. Good communication, we kind of already touched on. And the most important thing she found in the feedback from the staff that she got, and she got some good ones and really built her team, and she's kept them now, most of them for over a year, is to do things to let them know that she really cared about their well-being. So what do you guys do? Do you guys have ideas for us that we can share on what you can do to let your staff know that you do really care about them and their well-being? Any ideas? You want to share? I got my tickets.
I will say that for us, I believe.
Wait, you gotta stay in the microphone so our people in the virtual world can hear us. Here we go.
I think all of these things are so important. I think hiring the right people is very important. I think there are questions that you ask during the interview process as far as to determine people who really care about other people, who will not stress out under pressure, because when you're in an office and the people are freaking out because, oh, this is falling apart, instead of going, okay, we're here to work together, this is a problem, but let's fix it. If you can determine that kind of person to hire into your practice and just build that kind of environment that is all about teamwork, not about anybody being more important than anybody else, but just working together. These are all our patients. These are all people that we're taking care of. And if you can hire those people, I think that's the most important thing, because you do become a family. And of course, pay is going to always be important. So it's important in management to think about that. But I really do think hiring the right team and just having that environment of teamwork and being able to rely on each other is probably the most important thing for the staff.
I love it. Team building, gotta have it.
So real quick, you guys, this is Mindy. She's from Ponda Medical Private Practice.
Oh,
She's been integral in growing.
By the way, Kathy, everybody's gonna do this on the
I can be a cheerleader if you just want me to.
Yes.
Okay, so you guys, this is Mindy. She's from Ponda Medical. She has been integral in growing a private practice here locally and expanding the group into Brazelton and Dawsonville and Alpharetta and Johns Creek, and then not just growing in locations, but then obviously in size. And I will tell you through many conversations, what she says, I've learned a lot from her too. It is asking certain questions because we are challenged, right? I mean, in the past, I feel like when we were hiring, usually people that come to interview, didn't matter if it was front desk or any aspect of an office, people had a passion for healthcare. You know, they wanted to be in that environment. I feel like what I'm seeing and what I'm hearing from many of you, that it's just a person that just wants a job. And so we are seeing a lack of compassionate or a lack of passion for healthcare. So through her questions, because we do a lot of, share a lot of resumes and back and forth, you know, might be a right fit for private practice, maybe it might not be for them, might be better for hospital. So we do work a lot. And I will tell you the questions, you guys should maybe tap into her afterwards, because the questions, the open-ended questions that she asks are very productive.
I love it.
Helping to find the right person.
That'd be a great topic for one of our future meetings, because interviewing is really important. And you're right, building that team and getting the right skill sets. Anybody else have anything? Talking about taking care of employees or making them feel like we really care about their, over here. Of course, the wellness center.
Hey everybody, I'm Maureen. I work in a wellness place. I'm the coordinator there. And I think it's really important, number one, to hire the right people. So when I'm in the interview process, I tell them about my journey. I came back to Northside because I'm a cancer survivor and I am going to retire here. The work that we do in Northside Values are truly embedded in who I am and what I do, as well as my assistant coordinator, Lisa. So we believe in what we do, the patient care and who we are. A lot of times we do random things, like we'll bring a breakfast in or a coffee day, we'll buy lunch. I love that Northside has excellence in action because there's nothing like opening up that email and saying, hey, thank you so much for a good job. It's the small things that make a huge difference. And every day when I leave, I thank them for all their hard work. People want to be appreciated and valued, and that's what we do. That's who we are.
Thank you. We were getting teary-eyed earlier when they were over here telling me about their new prosthetic laser technology, and I worked with Atlanta Breast Care about 5 years ago, and just to hear the advances and what you guys are doing now, it teared me up. I was like, wow, so proud of what we do in healthcare and what we can do to help patients every day. So thank you for sharing. Anything else? Any other ideas anybody has?
We touch base with our employees about once a month too. We just do we touch base with our employees about once a month too, just call them into the office, check on them, see how they're doing. Is there anything else we can do to support you? And then we also jump in with anything that they're doing to help them in that support. So I think it's important that they know that we can do the same job with them, but they're not on their own, and that they can always rely on us.
That's great, that ultimate support, right? That's great leadership. I love to hear that. And it is, it's, the day gets crazy and people start spinning out of control, and it's real easy to focus on the 2% of the badness, but it's up to us as leaders to step up and say, it's okay. I used to always say, you know what? We're gonna get to go home tonight. It'll all be okay. Eventually we'll get everything done and we will get out of here and get to go home. All right. Oh. All right, so some other shifting strategies after my friend's story, just more like a checklist. We've already talked about compensation, but what about equity pay adjustments? I think a lot of us over the last 2 years have had to grapple with this. So as people came back from the pandemic and younger people are coming out of school, I think expectations are a little bit higher. We've brought in some people at higher amounts, but what does that do with someone that's been with us and stayed with us for the last 10 years? They're gonna find out eventually probably you're hiring people in at a higher salary. So it's a very important discussion to have with our owners and when we're looking at budget, that we do those pay equity adjustments and think about that as new people are coming in. Bonus incentives. I love bonus incentives, but I love to tie them to people's work because once again, we get back to people want to be appreciated. They want to know they've done a good job. So for clinical people, I love tying it to patient satisfaction surveys. If you don't just give somebody a $100 bonus once a quarter, whatever it is, they expect it, right? They're like, we gave me $100 last time, where's my $100? But if you tie it to something that's tied to their work performance, so clinical people, I kind of like to do the patient satisfaction surveys. Are we getting above a 4.5 out of 5-point scale? Look at different areas on that. Billing people, one of my favorites is our key performance indicators, time of service collections. What are our collection percentages in our aging buckets? Front desk people, time of service collections is a great bonus incentive. And make it something simple. Make it something that you don't have to run 10 reports each quarter to get the data and all that. Just make it something you already have in your system that you can just punch a report out or go look at your Google results, or you're using a website service and using something more sophisticated for patient satisfaction surveys that can help you figure out how to do this kind of thing. So think hard about bonus incentives, but tie it to something. Don't just give somebody a bonus as a bonus. It's just not as effective. Do you guys find that? Yeah, see a lot of heads shake. Oh,
Yeah.
Yes. Now, are you with Dr. Pendy?
I am,
Okay, great. Tell her I said hi.
Absolutely. So yeah, I'm glad you brought that up because I'm getting a lot of feedback from our staff that that's something they're interested in. They want incentives. They want a bonus. I'm just not real sure the right way to make it happen across the board for all staff.
Yeah. Did you like some of my ideas?
I do.
Okay.
I do. Yeah. I think
What
the time
about,
service
do we
is
have
another-
other ideas? Anybody doing that right now if they're tying bonuses to incentives? So something to think about, we got one back here? Ah, here we go. Thank you.
Good morning. That's actually an interesting point because we just actually did that for our doctors and our staff. For doctors, we did it based on charges billed. And then for staff, we did it, we split it up between what they made in the last 6 months and reviews and productivity and, checking in with them and seeing where they stand. So everyone's been happy. Everyone's, even the new employees that came on within 90 days, they still got a bonus. Excuse me, you gotta make it fair for everybody.
Yeah, especially those new people. I'm glad that you included them.
Yeah.
Can you say your name and your practice?
Oh, sure. Gabriel, I'm practice manager at Victory Pediatrics.
Yeah, I love the great pediatrics. Bunch of old friends in the room.
Yeah.
Don't tell them I'm older than dirt. I've been around it too long. So good ideas, and also, my contact information is at the end of the slide. I'd be glad, if y'all just want to give me a call and kind of bounce ideas off of me, no charge, I'd be glad to just talk in a little more detail if anybody has any questions after today. So sign-on bonuses, again, tie them to 1 or 2 year commitment. I see this a lot more with physicians, nurses, the higher paid positions, where if they stay a year or 2, then they get that sign-on bonus. Let's talk about outside offers. A lot of us, I think, lose people to these outside offers. And I found that it's pretty effective the last couple of years to just start having that discussion with employees that, hey, if you get another offer, at least give me the opportunity, at least speak to me. Maybe I can't meet, the hourly rate that they've got an offer, but maybe I can look at that and say, wait a minute, they're getting more benefits. It's not the pay, you're leaving me for this. So it can be an education opportunity also. You may not be able to keep them, you may not be able to recover that, they may already be out the door, but you can learn a lot from it. And there are times when you can recover that. You can say, you're leaving for 50 cents an hour, look at the benefit. And people don't always think about that, especially you're talking about some of our younger employees that just, $1 an hour means a lot more to them right now. But if someone sat down and said, look, if you stay with us, we have 401k. We have some of these other benefits. And you go down the street, you're getting $1 more an hour, but you're not getting these other benefits. So sometimes it's just an education issue, something to think about with that. I think we'd already kind of touched on the non-certification thing, but I'm seeing that more in practices where there are certain duties that, of course, a medical assistant has to have that certification. But there's a lot of administrative things that they don't, that we can route their way. And maybe they're fine with that and they want to stay there, and that's good to find those people. But then there's also the ones, like you said, that you can, within 90 days, maybe they do want to get that certification because you're in a specialty where you need that certified MA. So I think that's a great idea. Who has a personal relationship with a placement agency, an employment agency? Do you have this? I know Kathy does, of course. But yeah, I think it's back in the day when we actually used to have managed care provider reps, right? And the big deal was to get a relationship with Blue Cross Blue Shield rep because they would help you with claims or whatever. Of course, we don't have that anymore. Now it's all virtual. But I find that it's very helpful. When I was doing the research for this presentation today, I called 2 of my key people that when they give good resumes, especially in pediatrics, because that's what I'm in for, they send them to me or they call me and say, hey, I got this great nurse, I got this great MA, do you know anybody looking? That's the kind of relationship you want to have with those agencies. And I guarantee you that's the kind of relationship that Kathy and Northside has with their contacts. And you'll be the first one to get those good resumes. So develop those relationships. They're really important. And those people will tell you, they will tell you what the new generation wants. They will tell you what someone that's my age, 50 or older, although I'm 62, is looking for. Because they know, they're talking to these people, and they know why they left their last practice, and they know what they're looking for going forward. So they can be very helpful to you. Another idea of expanding the advertising and recruiting, a lot of us go to job fairs, but one thing a friend of mine started doing is she makes the offer at the job fair. I'm like, really good, because they're going around to all these other tables, and they get all these calls after. You bring the offer letter, you bring all the employment paperwork, you have them sit down at your table, you make that offer, and you have them fill out all the paperwork, and you give them a start date. Now, they still may get a few calls from people trying to poach them after that they met at the event, but I thought that was a brilliant idea, and she's been able to get a few people that other people didn't get at the local job fair. So we have Mary Beth. Mary Beth, introduce yourself real quick for me. She's with University of North Georgia, correct?
You already kind of did it. I've been
Well,
born and raised
tell me
with the University of North Georgia, and I work in the healthcare sector at the university. And so really interested in trying to figure out how we might be able to partner with you guys on some of these things. Also very familiar with our friends at the technical college. And maybe there's some really cool pathways that we can work on. The biggest challenge for us in education is the state budget continues to be cut. And so getting faculty is our biggest issue, but we just partnered with Northside on the nursing side, where Northside is providing us the clinical faculty. And so it's an opportunity for us to have almost 250 nurses here at the school, our pre-nursing students. And so we're really excited about that. So I think we can do things like this on this side as well. So eager to talk more about all of this and figure out pathways.
Thank you for being here, we appreciate it. So I was lucky enough to meet Mary Beth right before the presentation. I have worked a lot with Lanier Tech in North Georgia with their medical assisting programs. And I reached out to them to get the new coordinator's name to see if they are looking for practices for the medical students to do their externship. I heard back I contacted the wrong person, so she's getting me with another one. So if I get a name, Laura, I'm gonna send it out to you to share with the group. So hopefully we can follow up on that. Who's heard of HOSA? High school students that are interested in healthcare. So about 3 years ago, I had the opportunity, maybe 4 years ago, to go to Lambert. They have over 350 high school students in their HOSA program. There are students that have already identified they want a future as a healthcare professional. And they have this huge organization, and they have, president and officers every year. So I had the opportunity to go in and interview candidates that were running for their positions for the next year. And just to meet these young kids was amazing. But they basically train them in MA duties. So they do height, weight, blood pressure, urinalysis, hematocrit, all kinds of things. And they're looking for offices to volunteer in. So get to know your local high school, get to know those students, because they will just inspire you. These people want to go into healthcare, and we need to get them into our practices and get them into some positive experiences, and they can help us. They can do referral forms, they can do administrative work for you, and they love that because they just learn. They learn, the more they learn, the better, right? Yes, Kathy just said some of the kids can get a phlebotomy.
Yeah.
Phlebotomy, thank you, they did.
And or CNA as well.
CNA, yeah.
And Gwinnett County Public Schools also has.
Wait, let's get up.
Talk to our people at home, or not at home, at your office.
Yes, and so a lot of those students get CNAs as well, and so this is something we can kind of look at. But Gwinnett also has the McClure School of Medicine or Healthcare. They have a whole school dedicated to that, and so that's a great opportunity if you got practices in both Gwinnett and here. Gwinett's
not that far.
Right, it's not, and those students live all over the county, but it's another one. And of course, the schools all have the healthcare pathway, so.
Cool, thank you. Of course, part-time, we have more and more people, I think, that want part-time, and I always like to challenge people that come to me and want part-time and say, that's great, go find someone else that can co-share with you because I need a full-time position. So I think we try to be creative with that as much as we can. Never be scared to add to someone's skill set. I've always talked to doctors like, well, I don't want a rock star, they're only gonna stay a year or two. I'm like, challenge them, I'm like, I'd rather have a rock star for a year or two than an average or below average employee that stays for 10 years. I want to have that rock star. I want to help add to their resume. I want to hire somebody that maybe doesn't have a certificate and say, oh, if you stay for a year, we have this such and such machine, and I'll send you to get certified on that. And that's something you can use to build your resume. Will they eventually leave you? Might they eventually leave you? Yes, depending on the size of practice and what opportunities you have. But I guarantee you, they're going to work their heart out for you and care about your patients and care about doing that for your doctor if you offer them those opportunities in your practice. And just finally, however you can transition administrative duties off of medical assistants, off of nurses, off of clinicians. We have so much time that our physicians and our MAs, just everybody spend doing administrative work, whether it's putting it in the EHR, doing a referral form, making phone calls, all those things. If you can hire somebody that can take some of that off of them, I guarantee you those MAs are going to stay longer because they hate, most of them, doing that administrative paperwork. Yeah, please.
I'm a medical assistant also, and I worked at Northeast Georgia Medical Center. And we did all of the administrative side of it also. Then I went to the diagnostic clinic and we have prioritization part, and then we have a research department.
A lot of support, right?
And then I started, getting my director started, an outgoing referral department. So all the nurse has to do is put in where they want that patient to go, and then
Someone else does that.
somebody else does it.
Yeah.
And it has taken off so much work off of these.
And they're happier?
Yeah, because, you know, they have a number they have to do every day, that's right, and you're able to meet that, the doctors are able to meet that because of the treatment. So,
Right, and think of the quality of care and patient satisfaction you need to with that. Yes, ma'am, I know. It's great, I love it, give more input.
I definitely agree with the, admin duties removed from the MAs. The problem is the smaller the practices, the more we don't have the resources of these different departments to do it. And prior authorizations and pre-service and cover my meds for all that stuff, it becomes more and more paperwork, unfortunately, and it does need to be divided amongst the team. So it's hard to get around.
It is hard. Anybody have any ideas on that?
What we've done that's helped our provider retention as well, okay, portal messages. Do you guys have, portal messages can be overwhelming. We have hired what we refer to as a CSA, which is a clinical support assistant in every office, who is in those portal boxes all day long for our providers, for our MAs. They just work, that's all she does. She is in that box. And if there's something that needs to go directly to the provider, she goes directly to the provider. We have at least one in each of our offices. Larger offices, we have a couple. And that, I know that seems like an expense, obviously, for another employee, but it is tremendously helpful for all of our support staff and for our providers. Our providers have really loved when
I can imagine
that.
Right, right. And I've seen a lot of different models on that, and unfortunately we're running out of time, but I will just add a little bit. Front desk staff, if they're not answering the phone, if they're doing check-in, they might occasionally have a little downtime where they can help with those kind of things. You have people like a phone bank, where people are just answering the phone, sometimes they have some downtime, so I've been able to shift like maybe on that referral people or some of the specialists, referrals to specialists, things like that. All right, little cartoon, talking to your receptionist made me feel so much better. I'm canceling my appointment. So we're gonna quickly, because I'm out of time, go through culture and some other things. I think we all know this, how do we get employees engaged? We know what employees want. We've had a pretty good discussion this morning on some of the things that we can do. But we want culture of respect, work-life balance, proper training, equipment, supplies, and of course there's opportunities and challenges. A tool for you guys to take back with you. This is a survey to evaluate your employee engagement. So I have 2 slides here with just questions. I'm not gonna read through them because we're out of time, but you guys can take this back as a tool. I think it's really important. If you give this to your employees, they will understand that you do truly care about their well-being, because these are the kind of questions that you're gonna ask them that shows that you care about them and how engaged they are in the practice. And of course, the most important thing when we do a survey like this is to make sure we give them feedback. So the worst thing to do is ask somebody their opinion and then not do anything about it. So if you're gonna do the survey, please take time to sit down, discuss it with them. Some things you might be able to make better in the practice that don't cost you a dime, and they have a lot of good ideas. Other things you might have to sit down and say, I'm sorry, that's a great idea, but it's just not in our budget right now. So it's a good way to have those discussions and let them know you do care about them. But always remember, you can't fix stupid, but you can sedate it. So some free ideas, again, my favorite 4-letter word, free. Weekly wisdom, so I got a lot of practices down. They have a whiteboard up in their break room, and someone will just put a little motivational saying on there every day. You had talked about getting an email from Northside just with an appreciative name, gratitude. Gratitude is not always something that we're born with. I've had to teach some doctors how to do that. Oh, Nancy, I tell my nurse, my medical assistant, thank you every day. And I'm like, I've talked to a couple of them, I'm not quite getting that same feedback. Oh, yeah, I got, look, you're busy, I get it, you have your priorities. So I'll never forget this, Roswell Pediatric Center, there's an old friend in the room that Craig Greenberg and I worked together, we had the same EHR system, he was in the OB group, so we were good friends. And I challenged this doctor, I said, I'm gonna put 10 pennies in this pocket of your white coat today, and every time you compliment whoever's working with you that day, I want you to take a penny from this pocket and put it in this pocket. Oh, I got it, Nancy, I got it. So in the morning, she's good. She's got like 3 pennies. By the end of the day, the other 7 were still in her pocket. You know, it's just her personality. She's got busy, but it was a visual way to point out to her that you can do a little bit better on that gratitude. Go to your local vendors, sometimes printers like Derek will give you notepads. Local restaurants and stores, after the pandemic, they're looking for things too. So if you go in there and say, hey, I have 20, 25 employees, would you give us a 10% discount? Go to a grocery store, your local store, you'd be surprised, like the farmers markets and things like that. They're trying to get people in the door too. So anything like you can do for that, for your employees nowadays, just to get them that little thing, like you said, it's little things that let them know that you care. Charities, always, you know, I love to do the 5K runs or raise money for breast cancer, whatever it is that might be of interest with your employees. And then don't forget the dollar store, the Costco candy aisle. Form a fun committee. Let people in your practice get involved and let them decide what's fun or handle the birthdays and the baby showers and those kind of things and make it into an engagement thing. Here are some good books if you're looking for some fun games to play in your practice. One of my favorite ones, especially if you're going through an EHR implementation or install or any module, is Marshmallow Dodgeball. So everybody's all stressed out, you go to lunch, provide lunch, you have a fake line go down the middle of the thing, you give everybody a bag, a Ziploc baggie with those big marshmallows in it, and you just have at it, marshmallow dodgeball. That will get some frustration out. So here's some books that you guys can use, not only in your office, but there's also like virtual team building games. So for our people at home or people that have people that work remotely, I know that's a lot more common nowadays, there's some ideas on there. So don't forget to have fun in your day and bring that into your employees because that will make them want to stay too. Humor is a major, major attraction for most people, especially in the stress that we live in every day in healthcare. So I want to thank you guys for having me here today. It's been fun, and y'all have a great day.